Welcome back to Singapore Tonight. Thank you for staying with us. Now, Singapore is facing a fast-aging population, and with that comes a host of health problems, including a rise in dementia cases. But according to the National Neuroscience Institute, what's more worrying is the alarming rate of younger people being diagnosed with the disease. Now, that refers to the onset of dementia before the age of 65. Glenda Chong has more.
Madam Annie was only 55 years old when she was diagnosed with young onset dementia.
It started because she keeps on repeating the same questions, and she was driving at the time, so she would get lost on the roads in Tampines where we used to live, like on the normal road where she used to drive every day, right? Then she would get lost. Just daily small things, and then we started to realize it's a bit slightly abnormal, like things that she shouldn't be forgetting, right? She starts forgetting frequently and repeatedly. Forgetfulness was getting really bad, really obvious and really bad, like in her daily tasks. So we brought her for a checkup in Tan Tock Seng, and then after that, she was diagnosed with Alzheimer's.
What is dementia? I think they are losing something in their brain somewhere.
Dementia is a brain disease that causes the brain cells to die faster than normal, and the most common type of dementia is Alzheimer's disease. It typically hits people in their 70s, but that's not the case anymore today.
Misconceptions number one is anyone below 65 cannot get dementia. So I think that's the most important misconception. So my youngest patient with dementia is about late 30s, 39 years old. Right? So it can happen as young as 39 years old. So dementia in the young is out there, and they need to be diagnosed early.
A study by NNI showed that in 2011, there were only 32 patients who were diagnosed with young onset dementia or YOD, but that number has been rising steadily. The greatest increase was in 2014 and 2015. Last year, out of 481 dementia patients, about 35% were young onset patients. While dementia in older people usually show up as forgetfulness, in younger people, this is different.
A younger patient is more likely to present with problems with language, which is very unlikely or less commonly seen in the older patients. The other common presentation in the younger patients is behavioral change. Right? So this too is important, because when you talk about dementia, the general agreement or understanding of dementia is a memory problem. So first of all, when you have this set of symptoms that is different, meaning language and behavior, and then the age is someone who is not the typical elderly patient, then dementia often doesn't come out as the first differential diagnosis. And this is a problem both in the community to the lay people, but also among healthcare workers.
Jennifer was diagnosed with young onset dementia in 2015, but according to her family, she was already showing symptoms much earlier. But doctors did not diagnose her with having dementia.
It was some years ago that we find that she was slowing down in her responses. Whenever I asked her some questions, she would actually answer the question with the same question, before she delivers her answer. So that went on for quite a period of time. We actually managed to see her favorite family doctor. But the favorite family doctor was also of the opinion that, she's a bit too young to have this kind of situation. So don't worry too much about it.
There is no cure for dementia. The average life expectancy for those with young onset dementia is 7 to 8 years, while for older patients it averages about 10 years. While there are many centres in Singapore serving older persons, there is only one such place for those with young onset dementia.
Currently, this is the only program in Singapore that serves those with young onset dementia. It's a collaboration between Tan Tock Seng Hospital's National Neuroscience Institute and Alzheimer's Disease Association. Called STEAM, it focuses on early stimulation, exercise and emotional support.
Because there is no previous program in Singapore for younger onset dementia, when we first started off in December 2014, we did not have any benchmark. We do not have any guidelines to see what are their actual needs. Yeah, all we know is that, oh, you are very young, you are down with a certain type of dementia and you need some help, but where to go to for help? Yeah, so at least right now, after trying the program for almost 2 years, we have a picture of what are their needs, just that we are still trying to find the direction to help them. We try our best to use different types of interesting activities to stimulate different portions of the brain to keep, in hope that the dying of the brain cells will be slower.
For me, I'm okay. I don't have dementia. Okay.
Dementia not only robs the person of his memory, it also robs the family of a normal life.
You just don't know whether at that point in time when you're talking or having a dialogue with a person, you're getting a logical answer, rational answer, or some make-up stories. We really don't know.
For Dino, a big part of his time is spent looking after his mother.
Initially, we didn't really see the impact it was going to have in future. Like, we just thought, oh, okay, young onset dementia, okay, so what next? Just medication? Oh, okay. Then after that, as it progressed, we realized this is quite a big thing. It quite affected our whole lifestyle strongly. Like, I mean, other mothers in my mom's age, they would be still working, having a social life, doing the things on their own, right? And I'd say 30 to 50% of my life now is focused on checking that she's fine, focused on arranging her life for her while I still have my life to manage. So I think that's quite a big sacrifice now for me. And it gets really tiring sometimes.
According to Dr. Nagarendran, Singapore still has some way to go with caregiver support compared to other developed countries.
We still have a long way to catch up. Compared to countries like Japan, UK, I think there have been a lot more efforts to support patients and carers out of in the non-hospital setting. Community centers where you have social workers going to homes, providing meals, talking to these patients, and that actually does a lot of relief to the caregiver. So I think there's still a lot that we need to do in Singapore to match up to what other developed countries are doing.
It's estimated there are 40,000 people in Singapore with dementia today, and out of that, 10% are young onset dementia sufferers. And this number is projected to double to 80,000 by 2030 as the population ages.
That story so clearly illustrates, Steve, how important support for the caregivers of dementia sufferers is as well, doesn't it?
Yeah, it certainly is. An early detection and being able to sort of understand and accept that is exactly what's happening.
Yeah.